Welcome all, sparing your time for a Sunday morning for this very informational and educational session. So today morning I was thinking of, the weather is quite cloudy and I was wondering whether it is going to rain. I'm not sure whether it will rain outside, but today here it is going to rain knowledge. So I'll introduce our guest for today, Dr. Ananya. She is one of the distinguished students, alumni of MLDMHI. She has done her MD Home Psychiatry. And she passed out in the year 2012. Post that, she has done her master's in psychology, and currently she is working as a homeopathic psychiatrist and a psychologist with Emoticons India. In addition to that, she has got great academic achievements like publishing peer-reviewed papers in the subject of psychiatry and homeopathy. And today's session is going to be all about MD Home Psychiatry, the subject which Dr. Ananya specializes in, and we will try to take it to the depths possible where students can understand what exactly the subject is, how it is going to help them, what the education is going to be like, how the career would be like after MD Home Psychiatry, and we'll ask some questions related to that to Dr. Ananya. And yes, in the end of the sessions, I will also request students who have joined the podcast today to share their questions, to ask their questions, so that Dr. Ananya can answer them to the best of her knowledge. So, Dr. Ananya, the first question is, why did you choose MD Home in psychiatry, and that too from the College of MLDMHI?
Yeah. So, why did I choose MD Home Psychiatry? So, I think, most of us who take up psychiatry or psychology, they are many times motivated by their some personal story of own. So even I had some personal situations in my life before even I had started my 12th standard, which always made me wonder why people behave the way they behave. What can we do about it? I had seen some very difficult situations right there in my family. So that would always trigger my interest that something needs to be done about this. There has to be something that can be done, and why not I take up either psychology or psychiatry. And by default, with my parents thinking that arts might not be a great field in terms of career, they made me to go into science, and then it was very clear that I had to go and pursue medicine and take up psychiatry as a specialization. Obviously, for obvious reasons that I did not score adequate marks to get into MBBS, I decided to go into homeopathy, because by then we had a specialization of MD Home Psychiatry. And that's how I joined MD Home Psychiatry. Apart from that, I would just want to mention, for anybody who are thinking of MD Homeopathy Psychiatry here, it is quite a field to choose today, because if you just go through certain statistics, which had come in 2017, it said that 19 crore Indians today suffer from mental health issues of some kind, right? And one more study that was published in Lancet last year, it said that there has been 35% increase in the kind of, or rather in the mental health issues since the pandemic era. So we are looking at crores and crores of Indians who are suffering from some mental health issue, and that puts us in a position where we can actually go and pursue MD Homeopathy Psychiatry and make a difference to this scenario, because another statistic said that only 0.75% of psychiatrists are there per 100,000 population that we have. Right, so there is a scarcity of mental health professionals, and with our specialization out there, it is a huge scope for us to go ahead and choose MD Homeopathy Psychiatry. So these are two reasons why I did MD Home Psychiatry and why anybody can think of this as an option further. Coming to the second question that you asked as to why MLDMHI for MD Home Psychiatry. So I'll answer this in two parts. The first part is a very obvious reason, that is ample amount of clinical exposure. Now, when I'm talking specifically of the field of psychiatry, let us be clear that it cannot be that I sit in the OPD, patient comes and tells me the symptoms, and I am sorted. Okay, the person is having depression. No, it is not that straightforward when it comes to diagnosing mental health illnesses, right? As we have in physical illnesses, diabetes symptoms are going to be more or less the same. The investigations that we are going to order are going to be more or less the same. So it is not much of a task when it comes to diagnosing our regular physical illnesses. But when it comes to mental illnesses, they are very complex, intricate. They have overlapping symptoms most of the time. So it is not that I attend few OPDs and I learn psychiatry and I know to treat psychiatry. It cannot happen that way. You need a very structured, specialized training for that, not just at OPD level, but also at the IPD level. Like what cases I can treat with homeopathy at IPD level. Can I treat active schizophrenias? Can I treat brief psychotic disorders? Can I treat violent patients such as the ones who have alcohol withdrawal or mania? Right? They need to be admitted in IPD, and then how should I go about with the homeopathic treatment? So even that exposure we need, which is very less if you go outside MLDMHI. There could be very few colleges who offer that kind of exposure at IPD psychiatry. That is the second thing. The third thing, again, as I said, psychiatry is never restricted to just running an OPD. Okay, you have to go out there in community, think about preventive psychiatry where you can run certain preventive programs and preventive mental health programs in schools and colleges and corporates and organizations. So it is not just about curing psychiatric illnesses, but also preventing mental health issues, which are so much on rise. Right? So even that exposure we need if we want to become a successful homeopathic psychiatrist. So exposure at community level, exposure at OPD level, exposure at IPD level. Again, in community level, there is a lot we can do when it comes to not just school, colleges, but we have other areas such as old age home, orphanages, where there are going to be high levels of mental health issues. Right? So unless and until I get an exposure to that, how will I understand that what can my homeopathy do there? What else do I need to do there? What is my scope? What is my limitation? So it is very clear that if I want to become a full-fledged homeopathic psychiatrist or a mental health professional for that matter, I need exposure, maximum possible exposure at all three levels, OPD, IPD and community. Okay, which is very much there, I can confidently say, at MLDMHI. So that was my first reason. Another lesser known reason or lesser thought reason from my end was the research part. Okay, so psychiatry as psychiatry in general is still something where people have not found answers. Even the modern medical world have not found answers for most of the conditions or many of the problems, right? We don't have clear answers for that. It is still under research, and in that, MD homeopathy psychiatry is still much more in its infantile stage when it comes to research. Okay, so again, if I want to understand how homeopathy works in psychiatric illnesses, of course, Dr. Hahnemann has given us the guidelines. But then in today's era, 250, 300 years down the line, when the nature of mental health issues have changed, the way mental health issues present have changed, how my homeopathy works, how it should be applied is something that we need to research big time. Right? And that will contribute to homeopathy as well as to me as a practicing professional. So I need that exposure even at research level. And again, at MLDMHI, we having an independent research department since from its start probably, it gives us an ample scope to experiment, to study homeopathy in various psychiatric conditions, to understand how they work, and to really come out with some insights when it comes to homeopathy and psychiatry and curing of all these problems. So I think even that exposure is very essential for us in terms of becoming a successful professional. So all these levels, if you're getting this exposure at MLDMHI, then why not MLDMHI? Right? So that is why it was my reason to choose MLDMHI. And I think those who have joined here, I would request you all to follow MLDMHI, because you will come to know the amount of work they are still doing at various levels in psychiatry as well as otherwise too. So that is one way to, or rather that is one thing that you have to keep in mind, that do not take up MD homeopathy psychiatry because in one college OPD runs very good. Check for all these things if you want to take up MD homeopathy psychiatry, whether you want to get exposure at all these levels. Right, so this was my reason that why I feel one can join MD homeopathy psychiatry at MLDMHI.
I think you have practically given the students a checklist, how to choose a college for doing their MD home psychiatry, and also probably motivation that one would need. It is definitely a personal motivation, but more than that, what I say, the society at large needs homeopathic psychiatrists. Looking especially at the load on the healthcare system, we need more people who are trained, and not just trained very well to treat psychological issues efficiently. Much appreciated for that insight into this question. This is going to take me to the next question. What has your experience been as a MD home resident in the Department of Psychiatry at MLDMHI?
Yeah, this is something I would really want to share over here. First of all, when we choose MD homeopathy in psychiatry, and that to MLDMHI for all the reasons that I mentioned, remember that we are going to be 3 years staying at the institute. Okay, it is not like otherwise what MD homeopathy we see, where you go to college, you do your OPD, IPD duty, you come back home to your own comfort zone. It's not that. You're going to stay 3 years away from your family, away from your primary caretakers, away from all possible comforts that you would otherwise get at home, and you're on your own for every smallest and single thing, right from your washing your own clothes to managing your own food. There is not going to be your mommy or daddy who is going to come to you and tell you ki beta khana kha lo, and all that stuff. So for the first time, probably you're going to stay in an environment where you will be more or less detached from almost everything that you are doing in your life till date, right? And that puts us in a position where it can go two ways. One way it can go is that we rise from all of that as a very resilient individual, and one is that we might not just be able to manage and maybe run back home, right? Now, the thing that what happens at MLDMHI is that they focus very much on the learner care, okay? So they do understand that from where we are probably coming for the first time out there without any kind of support system otherwise. So they are giving us that learner care. Now, do not misunderstand me when I say learner care. It does not mean that they will offer you very nice, comfortable room, or they will offer you very homely food. No, that does not mean learner care here. Learner care means they will facilitate you so that in spite of you coming out from your cocoon for the first time, how you will become a resilient individual, how you will become an independent individual on your own, not just in managing OPD, IPD ka cases, but also to manage your own self, your own daily life, your own emotions, your own thoughts, okay? See, psychiatry is not a cakewalk always, right? You are going to listen to stories which are very, very dark, which can be very, which can shake you to your core, right? While you manage psychiatric cases at OPD and IPD level. And that is where you need somebody to guide you, to facilitate you to come out of that turmoil. Sometimes there are conflicting situations that arise when you're dealing with psychiatric cases specifically, that you are sensitive towards certain things, and then that sensitivity points are triggered, and all these things create quite an emotional turbulence within. Okay, so who will handle that when you are out from your own comfort zone? You don't have your parents out there to every time go and cry or every time go and vent, right? So that is what MLDMHI offers you, where they facilitate you to resolve your own conflicts, to build certain qualities which are important not just as a doctor or as a homeopathic psychiatrist, but as a human being. It starts from working on your sensitive areas, working on your unresolved conflicts, working on developing empathy, working on developing rationality or bringing rationality to your thinking, and a lot more. Right? So this part of learner care that comes during the training of MLDMHI, I think is very crucial, apart from all the clinical exposure that I said that we get over here. Okay, so considering that, I think, and how do they do that? I was really impressed when I realized that whatever I have in my mind, I can express it right to my mentors or to my professors or in my department, and they were the people who would give me that unconditional space to express, non-judgmental attitude towards me, and that space to discuss, deliberate, to arrive at my own resolution, which I think again might not be a very seen feature in most of the organizations otherwise, right? So this space that you get, which is provided to you by MLDMHI, is very important because it forms you, it shapes you as a person, apart from shaping you as a good clinical person, but it really shapes you. And that is one thing that was my experience with MLDMHI. At 3 years of my life, I think they prepared me for life, not just prepared me MD homeopathy psychiatry. So I think that is one of the very important things that is seen in MLDMHI and has been my personal experience too. And apart from that, the clinical postings, again, right? So it's not that you're a psychiatry student, so you'll get only psychiatric postings. No, doesn't happen that way, right? You will be repeated, or you will have to go through various clinical postings. Rather, I remember in our times, we had to do at least, or we were always given at least one medicine posting, wherein either there was a posting in casualty ICU or either there was a posting in the medicine department per se. Because fundamentally, let us know that you cannot arrive or stamp on a psychiatric diagnosis many times unless and until you have ruled out all the physical causes which can contribute to developing a mental health condition. Right? For example, simple thing, depression ka case hai, but whether that is contributed by hyperthyroidism. So to be very clear with your medical skills as well, your medicine knowledge. So you are not going to get just exposure of psychiatry, but as an MD resident, you will have to do various other postings. I remember I doing casualty posting for a while, medicine posting for a while, ortho posting for a while. In the Malad Center, what we had at that time active for residents, we got all our gynecological posting where we conducted deliveries, assisted surgeries, surgery posting. So that sets the right base to further move on to your specialty postings, that is psychiatry, right? So these are, this has been my experience which shapes you clinically as well as a person. And I think that is very crucial to have this perfect blend of both clinical training as well as a training for life and living. I have to mention NLT Sir's life and living sessions, which taught us psychology per se. You know, how interpersonal relationships work, what is the dynamics that goes on when two people live together, what are the psychological processes that go on together. So although we were in MD psychiatry, I think we received fair amount of psychological training in psychology too, or training in psychotherapy too, although we did not name it as a psychotherapy session, but we got our training there for that. So that's why I think my 3 years of MD residency, I always thank MLDMHI because it set the tone right, not just for the career, but also for my life.
Wonderful. It almost sounds like, you know, the whole journey sounds like, you know, it prepares you to become like a yogi or yogini. And I say so because then that is how you can actually make changes in the society. You can become the medium for change. So going to the next question, how was your life after your MD home psychiatry, career and things so far and things beyond career?
Yeah.
So it's been almost 10 years now that you have started your practice.
Yeah. So I think after finishing 3 years, the first thing that we got an opportunity at MLDMHI itself was to join back the organization as a medical officer. So that is another positive of MLDMHI, that after completing your 3 years of training, you also get a chance to lead the department, lead in terms of, you know, of course under consultants, but take charge of the department in some way or the other, where you can test yourself that what all things you have learned and see yourself applying all of that. So my first venture was where I, of course, opted for the psychiatry and medical officership. Again, I think there are always your mentors and consultants who help you to guide through that what you can do further, right? So they did help me in arriving at a decision to continue my MO-ship there after I finished my residency. So I did my medical officership there, but as life has in its store, I got married and I had to relocate to Pune. By then I had also started my homeopathic practice, and by the way, I started my practice as a homeopath. Okay, not like a homeopathic psychiatrist. Because back then, although I had interest in psychiatry, I was like, jaise cases aayenge, psychiatric cases aayenge, so I will obviously treat them, but let me start off as a regular homeopath. Okay, and that can be an option. But when I relocated to Pune here after my wedding, for some reason, I got an attachment in hospital where I put my degree as MD home psychiatry. And people started to look at that degree displayed outside the hospital board. And by default, I started to get only psychiatric cases. Okay. And as I said, because back then I was not aware of the statistics that 19 crore people in India in some way or the other have mental health issues. So in my area, at least 1 out of 6 cases that walk in my clinic are going to be of some psychiatric issue. right? So back then I did not have an idea of the statistic, but I started to see that once patients started to come in, specifically after seeing that degree of MD home psychiatry. Because for two reasons, people are not very much open to take allopathic medicines even today when it comes to psychiatric issues. Homeopathy is still looked at as a safer option, as a more natural option. And in psychiatric illness, people would choose, okay, if there is something in homeopathy, let me go there. Right? So that is why I started to get a lot of psychiatric cases, and as I started to get those cases, I realized that maybe I have to, I can, or I am at a position where I can make my niche as a homeopathic psychiatrist in my area. Okay, so that's how my journey into being only a homeopathic psychiatrist started. Other reason why I decided to focus only on the psychiatric field, not just because of the expertise that we already have, is also because it is different when it comes to practicing as homeopathic psychiatrist and practice as a regular homeopath. Why I'll tell you, because psychiatric cases need that much amount of extra time when it comes to case taking, talking to the relatives, exactly diagnosing, running some psychometric test if you want, and later on even in the follow-ups, you might your follow-ups need a little bit of more time as compared to other regular follow-ups of physical illnesses. Okay, so given that, it became very difficult cognitively also for me to mix both. On one follow-up is of diabetes and other follow-up is of major depressive disorder, right? So it became cognitively and practically difficult to manage both together, and that is why I chose that let me restrict to psychiatry, because that is where I was getting a lot of cases from, right? Again, this may not be applicable in tier 2 or tier 3 cities where people are still not that much aware of. But tier 1 cities, definitely, this can be one way to think that should I go directly for a MD home psychiatry practice, or as a mental health professional, should I start my practice? So that is how I began, and post that, I had varied experiences, because I started as an individual, but I realized that many times you need a team to manage certain psychiatric cases. So I started to connect with different professionals from the same field, clinical psychologists, remedial educators, and so on and so forth. One interesting thing that happened during this time is that where I would send some patients where I realized that a structured remedial education is needed for the child, or a structured psychotherapy is needed for the child along with my medicine. Patients would go, no doubt, if I refer to somebody. But they would come back saying that, doctor, I'm not that comfortable with the person, because now I have bonded with you already in some way, right? Because as we all know, our homeopathic case taking goes in so much of details that there is already a rapport and a bond formed between you and patient, even in non-psychiatric cases, right? Because our homeopathic case taking goes at that depth. So soon I realized that patients were refusing to go to other therapists or other counselor, and sometimes it becomes very difficult for patients to again relive and retell their whole traumatic experiences to somebody else and then create a bond. So it is quite taxing for the patient also. That is where I decided that maybe I have to go forward and also receive a formal training in the counseling or psychotherapy part. And that's where my journey started into venturing into the psychotherapy zone. Okay, and many of the cases, to be very honest, it never happens. Some cases like, it's a case of OCD for that matter, and you just give your Similimum and 6 months the patient is only on Similimum and the OCD is all gone. Many times it may not happen. Most of the cases require an integrated holistic approach. Okay, where you have to have a good combination of homeopathy, need be bath lab or need be counseling, etc., etc. Right? So going by that experience of mine, I ventured into the counseling and psychotherapy part, and that is how my career started. It's not just as a homeopathic psychiatrist, but as well as a psychotherapist. Coming to beyond part, yes, I will tell you one thing, that taking up MD homeopathy psychiatry and further on getting trained in psychotherapy helps you in some way or the other in your personal life. I got a huge personal benefit where, because I had that training, I could diagnose my son who is on spectrum way before anybody could have figured it out. So when he was just 1.5 years of age, I could sense that, and he received the right kind of therapy since then. Today, bringing him almost out of the spectrum. Right? So you just don't know what knowledge of yours from that can help you at what level. So it goes beyond that. It goes beyond an extent where you see yourself 10 years down the line. When I look at myself and today when I look at myself, I think there is a huge difference in the way I think, in the way I perceive people, in the way I form my relationships, which is a positive change. Right? So it is not just about having a great career, but it is also about achieving that last pyramid at Maslow's level, right? The self-actualization thing. Not that I'm self-actualized altogether, but at least having this training helps you to move ahead in that pyramid. Okay, quite easily as compared to somebody who might not have had that training. So it goes beyond the earning money part or earning the professional part. And I think I had also made a post where I had shared that why it is very rewarding to be in this profession. I think the day when I see that I don't see any cuts and self-harm marks on my patient, you know, money doesn't matter. I know that I've saved a life. The day when somebody says that I have been able to give a successful presentation in my company after quitting 3 jobs just to run away from presentation, I know that a life is sorted. And it's not just that life, because mental health illnesses are such that even one person in the family is affected, all others are equally affected. Okay, it's a family disease. I see psychiatric illnesses as a family disease because one person is in depression, the whole family is going to have a problem. It's not like one person has diabetes, so sabko diabetes ho jayega. Obviously, people will be worried about that person, but their life goes on without much of a problem. But a child is autistic in a family, or a person is major depressive, or somebody is having schizophrenia. I've seen the whole family collapse into the bout of depression, right? So it becomes very rewarding when even that one person you see improving, and it is very satisfying. It gives you that sense of contentment that you have not just helped that one person, but probably that entire family. Right, so that is why I think MD homeopathy psychiatry is not just about career or money. It goes way beyond that.
Wow, we are nearing half time right now, and I'm going to say this, that after listening to this much, I feel that everyone who is going to do their MD homeopathy, they must do it in MD homeopathy in psychiatry. And I would request the audience to type in the comments if they too feel so, because the amount of change you can bring in someone's life is phenomenal, simply. So yeah, we'll go to the next question. What does a practitioner need to know to be, beyond their regular practice to sustain and grow professionally? This is a little offbeat question, yeah, but relevant because we are talking about a career.
Correct. Yeah, so MD homeopathy psychiatry is just first step, I would say, towards venturing into the field of mental health. Because as I said, mental health field is still growing. A lot of new things are coming up. You have new challenges. You know, unlike our physical diseases, which are abhi API agar khologe na, so there is not much change in the clinical symptomatology of asthma, diabetes, hypertension, etc., etc. Not much change, only changes or upgrades in the treatment part. But in mental health, there are still every year, every time the DSM comes out in its new edition, we have certain things changed in the diagnosis. OCD was initially put in anxiety disorders. Now it is a separate chapter altogether. PTSD was an anxiety disorders. Now they have given a separate status for PTSD when it comes to diagnosing. Or internet addiction was never a condition even thought of 10 years ago. It was not even a part of most of our psychiatry textbooks or even DSM for that matter, right? But today there are discussions on whether it should be officially taken up as a psychiatric problem today, a clinical psychiatric disorder. So things are very dynamic and ever changing when it comes to mental health, simply because mental health is not just about how I take care of myself. A change in economic policy, a war going on, massive layoffs, global recession, pandemics, everything will have an impact on the way the civilization moves ahead, the way the minds of the civilization is going towards, right? So the way world changes, the picture, the whole global scenario of mental health changes, right? That is why I in MD homeopathy psychiatry, that is the first step. That's what I said. And after that, you have to go on and on to see that what kind of patients you're getting, what kind of community you're practicing in, what are the needs of that community that you need to address, and accordingly train yourself. Right? I'll tell you a small incident. I started in my psychotherapy journey. I started with learning cognitive-based behaviors, cognitive-based interventions like CBT, REBT, okay, which work on the thinking process of a person to change it. Right? But as the sessions progress, specifically post-pandemic, where we are dealing with a lot of cases of grief and traumas, I realized that only CBT, just making people understand how to change thinking, will not work anymore. I have to go a little bit beyond that, and that is where I started to get trained in ACT-based therapies, or acceptance and commitment-based therapies, or mindfulness-based therapies. You know, where let's not go too much into analyzing and reframing thoughts. Let's just work on acceptance, okay, of the situation and making most out of it. So I think the way I will go ahead with my career will be highly dependent on the things that change in mental health scenarios, or the kind of patients that I started to get. They determine that which path I should take further. Okay, so from CBT, I went to ACT. I realized I'm getting a lot of child psychiatry cases. So I realized that understanding child, even from homeopathic perspective, remedial perspective, play therapy is one option that helps me big time. Okay, where I observe the child, I literally play with the child and learn a lot from the symbolic language of play that he uses to communicate what goes on within him. Right, so that is where play therapy came into picture. Because again, I started to get a lot of child psychiatry cases, and a lot of things, sexual abuse, bullying, all these things started to come up in my practice, and children would find it difficult to word it out. To understand that, I took up that. So when it comes to career in psychiatry, you have to be, I think, always updated. Let the patients determine how you would go further, or what you need to do to make more your treatment or interventions more effective. So that is how it goes ahead, apart from your regular attending CMEs and stuff like that. So that will shape. I don't know, 10 years down the line, I might be working on some other interventions, learning some other interventions when it comes to psychiatry. It all depends on how the field of mental health progresses.
Right. So there is quite a lot to remain updated throughout the career in MD homeopathy in psychiatry. Not just that when you have done your MD homeopathy in psychiatry, you just continue with that. You have to remain updated with the what we call as the other sciences that come along with it, the therapies, the clinical assessments, and so on and so forth. Great. Now, having understood that the amount of work that you have done, I would want you to share with our audience, which is very relevant today in the field of homeopathy as well as in the mental health, more so in the field of homeopathy, because we are heading towards an era of evidence-based homeopathy. So we have contributed quite a lot to evidence-based homeopathy. So your thoughts on that, your experiences with that, and what would you have to tell people about it?
Right. So when we're talking about evidence-based homeopathy or evidence-based medicine, I will just like to throw some light on what am I exactly meaning when I say evidence-based homeopathy. Okay. So the quality of evidence is determined by certain things, right? So suppose if I say, homeopathy is very effective in autism, let's say that, okay. Now this is my expert opinion based on my experience or based on what my colleagues had seen through, and they have shared their experiences with me. So I can say that, homeopathy works wonders when it comes to autism or say depression for that matter. So this is only the first level of evidence which is coming from the expert opinion, right? This is a very basic level of opinion. This cannot be acceptable in a scientific world. Let's be thorough with that. Okay, you attend seminars, you see people saying, "Arey, bahut acha result aata hai, try karke dekh." It is okay for your practice, but this word of mouth will not be acceptable in a scientific world. That is first thing. Second thing, so what we have to do? If I have some experiences, I need to publish them in standard journals. Okay, so it could be simple case reports for that matter. I've treated few cases where I've got miraculous results with homeopathy. Okay, so I need to publish those case reports or the case series. Again, in a very standard journal. When I say standard journal, I mean Scopus Index journals. I mean the journals which are into Q1, Q2 journals. Okay. because those are the journals where the peer review processes are very strict, and those are the journals, if they have an indexing in Scopus, and if your data is published in that, nobody will question that data, right? So it will be very much acceptable by any other fraternity in the scientific world. So publishing that. Now, only publishing case reports is not going to help. I have reached to the level of publishing case reports and case series till now. This is still second or third level of evidence, okay? Further going on, what I need to or we need to do is that publish cohort or conduct cohort studies and publish data from that. That is next. After that comes non-randomized controlled trials. So if I want to, if I feel from my expert opinion and from my case experiences that homeopathy works very well in depression cases, right? So I have to conduct a non-randomized controlled trial where I will take at least 100 cases of depression, and that to a particular type of depression, maybe dysthymia or major depressive disorder, and I will treat those 100 cases with a very standard pre-post test design. Okay, ऐसे नहीं कि मेरे को लगा effect आया and हो गया, doesn't make sense. So with a very standard structured research methodology, I have to conduct a non-randomized control trial for at least 100. Those who are thinking that 30 is an okay sample size, I'm sorry, 30 is not an okay sample size, right? To have a proper statistical analysis and further a significant statistical result, you need to have at least 100 cases. So conduct NRCT on that. Once you see that yes, there is a definite result, then go for non-randomized controlled, randomized controlled trials where you will enter into comparative head-on studies. Okay, where you take an antidepressant, give it to 100 people, give your individualized homeopathy to 100 people, and then see what happens. Keep a control group of placebo for 100 people. Okay, so that is the kind of research that we need to enter into right away. Okay, because even today, when a patient comes to me and tells me, doctor, can you just share some studies? I want to stop my antidepressants, but can you share some studies in homeopathy where there has been efficacy found? At least I work in a tier one city where patients are educated enough to ask these questions. And I'm sorry, but I'm at a lack of that for that. Okay, I don't have too many researches where 100 patients were taken for placebo, 100 patients were given homeopathy, and 100 patients were given antidepressant, and then the results were checked. Okay, so it becomes a massive problem even today when we call about evidence-based homeopathic psychiatry. So we have to reach at that level, and this is not the last level, by the way. After that comes one more level is of meta-analysis. So if 100 RCTs were done of homeopathy with allopathy or psychotherapeutic comparisons, then a meta-analytical research is needed. That is the highest level of research. So we have at least 2-3 steps more to go when it comes to understanding and establishing homeopathic psychiatry as a mainstream medicine with scientific proofs, right? So that is what where we have to still work. If you ask me, my contribution is just at the level of, till now is at the level of case series and case reports. I'm working on a project which is on internet addiction, where we have a significant sample size of 1,000 children on which we are working to have, non-RCT done, but it is still way ahead. So those are thinking of opting for MD homeopathy, not just psychiatry for that matter. If you are going to take up a dissertation, please take up a dissertation which does not restrict you to 30 cases and checking efficacy of natrum mur in depression or homeopathy in depression. That research has been amply done by most of the psychiatry residents till now, or rather most of the MD people till now, right? We have to take up the next level, which is non-RCT or RCT with comparative studies. Okay, so please think on those lines, because that is where we have to still reach. There is a long journey ahead of us.
Agreed. When I look at it from the location of someone who is not an MD homeopathy psychiatry and listening to you right now, this may sound a little difficult to understand as of now. It may also sound boring simply because we may not understand this. But we need to stay tuned to this, because this is the present and this is the future. There will be no homeopathy if there is no research. Educated patients, yes, like you said, will ask, what is the evidence that you can treat something like this? Otherwise, I am not interested in investing my money into this, or not even investing in effort. I would rather go with a therapy which is time tested and proved. So,
correct.
Agree to that. Now, Now, before we go to the last part and the most interesting part, where I'm going to request Dr. Ananya to share a take-home message to all of us who have joined us on the session today, I would now like to ask the audience if they have got questions related to the subject at hand today. So all of you are requested to write your questions in the chat box. We'll wait for a minute for that. I see a lot of 100% and hearts coming in, and so I believe this was a very successful podcast. It seems people have resonated with this quite a lot, and I also hope that you have learned a lot from this. So yeah, we'll go ahead with the questions. Let's see.
Of course, I keep getting a lot of DMs about MD, homeopathy, psychiatry, psychotherapy, etc., etc. So yeah, DM is always open, but I might not always check the DMs. So yeah, but still I'm reachable anytime.
Okay, so I have one question, and kind of a supplementary question which came to my mind. While you were describing follow-ups of patients who have got mental health issues. So what happens if there is a comorbidity that comes with it? Someone was done their MD Home in psychiatry, and they have to deal with a psychological case where, let's say, it's a case of depression, and like you said, is the also has got diabetes mellitus, hypothyroidism, lifestyle disorders, etc., etc. Should that also be taken into consideration while taking up the follow-up, or I mean, how does that work? This is a little kind of a technical question in that sense. So how do we deal with that as a specialist?
Yeah. So, well, there are two scenarios which usually come up in such cases. One, many times what happens is patients come to me who are already on diabetic medications or antihypertensives, etc., and they're struggling with some mental health issue. So I prefer to give them an option usually, because see, our homeopathic remedy is going to be the constitutional medicine or something which is going to cover the totality eventually. Right? We are not going to like कि नहीं मैं सिर्फ mind part ठीक करूँगी तो mental symptoms ही लूँगी, and that's not how we work in homeopathy, right? We are going to consider the totality and give medicine. So ideally, if I'm giving a deep acting constitutional medicine for whatever psychiatric condition the patient has, or in other words, if I'm giving a similimum, it has the potential to also tackle on its own the other physical components. Okay. But what happens is that because already patient is on the modern medications for those conditions, we cannot really judge that whether thyroid levels are maintained normal or coming back to normal because of my medicines or because of the modern medicines, right? Where the patient is already taking them. So that is where I do give my patients an options, because see, legally I don't have a right to mess up with the well-settled dosage of the patient that is going on at that level, right? So I ask patient if they are, or I many times try to get in touch with the physician also who has, who's under which the case is. I'm starting homeopathy for so and I'm expecting that it will have a positive impact on these parameters also. So if you can please try to taper and see what happens. Okay, so that is one way to handle this. Sometimes it works, sometimes it doesn't. So I do continue with my medications and let them continue with whatever they have been taking, and they have been fairly stably maintained on that. Okay, so in that case, I just assess the improvement at the mental level and I go further. The other scenario is where patients themselves come and say, I have been taking so-and-so medications, but they haven't helped me. My levels are still fluctuating and ongoing. So I want to stop them. Anyways, I've stopped them already. Right? So there it is very easy that I start my homeopathic medication, and obviously I will then take care of the physical parameters as well. The diabetes or the hypertension, whatever the physical complaint is, right? So there, obviously, I will take care of both. Like, for example, I recently had a case of a child who is under allopathic medications for continuous sinusitis and rhinitis symptoms. And I saw the child first time in the OPD just few days back, where he was referred to me to assess behavioral issues and possible chance of autism spectrum, a 5-year-old child. And I realized that the child was told to be having asthma, but when I examined his RS was clear, although of course asthma medicines are going on for that child, but I saw typical adenoid feces in that child. Okay, and I asked the parents where adenoid has been ruled out by taking x-rays of neck or face or something like that, and they said no. Right? So now see, because when I'm seeing at that child, our approach has to be always holistic. right? So he was so troubled, he was mouth breathing, he was not able to breathe or talk properly because of that so much of congestion all over. And I could see typical adenoid feces. So I cannot be restricted कि भाई मेरा काम सिर्फ autism है कि नहीं देखना है या behavioral issues sort करना है, नहीं. Right, I have to enter in that zone and cross-check whether that has been sorted, because that terrible amount of adenoids is going to put child in discomfort, a continuous state of irritability, where he can, which can obviously be a part of his behavioral issues as well. Right? So I have to take care of that now. And again, they are on homeopathic medications too for that for last 3 years, but there has been no change to a major extent. Right? So I have to take charge of that and see if I can do something about it, talk to parents and find out if there is an adenoid scenario, if it could be surgically dealt, or I can deal it with homeopathic angle and give a remedy which will cover the totality. By default, it will cover mental health issues also of the child as well as the adenoid part if it is true. Okay. So that is how we can approach. So depending on each case, you can decide how you want to go about. But definitely you have to not shut yourself saying that mera kaam sirf mind dekhna hai. Because again, mind and body are both interconnected. So you cannot just shut off yourself and restrict कि नहीं मेरा काम mind देखना है, मेरे को सामने दिख रहा है तो भी वो उनका काम है, मैं कुछ नहीं देखूंगी. Okay. So that's it.
Okay. Right. So no questions in the comment box. So I believe people have learned aptly from this. Even if you have questions later on, you can DM the questions to Dr. Ananya on our Instagram handle. So Dr. Ananya, take home message for all of us.
Take home message very clearly. MD Homeopathy Psychiatry is an amazing field. Go for it if you are thinking, or if you are interested in, of course, if you're interested in psychology, then so definitely MD Homeopathy Psychiatry is your field. Always remember that MD Homeopathy Psychiatry is not just about treating patient, but it is also about growing yourself, okay, as a person. Unless and until you work on yourself, you are not, unless and until you work on the turmoil within, you cannot handle turmoil outside of your patients. Okay, so remember that and be prepared for that kind of training. Specifically, if you're going at MLDMHI, then be prepared that you will be shaken right from your core so that you turn to a new leaf, right? But and apart from that, never leave the learner's attitude if you choose psychiatry specifically. It's true for any branch of medicine, but specifically in psychiatry, never leave the learner's attitude. I'll tell you, every single life that you deal with in psychiatry, because you go in so much of depth into that life, you learn a lot about life. You start becoming grateful. You start identifying what is within you which you need to work on. So every patient teaches you after you complete your MD Psychiatry too. So do not leave that learner's attitude. I don't sit in the chair like as somebody as I know everything of, and that I am a fully resolved person. No, I also am a part of process of healing patients as well as growing myself. So that is what I think you all should remember.
Simply wonderful and inspiring, I would say. We would love to have you for another podcast sometime soon related to a separate topic clinically, possibly with something with cases. I know we did not have any case today, something that most homeopaths want, but it is also important that the homeopaths understand the concepts clearly before they actually dive into cases. There is one question that has come up. Can we take that up?
Yeah, sure.
So, can we do any diplomas or certified courses for learning therapy along with MD Psychiatry?
Of course, you can. Again, if you're doing MD Psychiatry from MLDMHI, I think time would be always a constraint, because there so much of workload is there that designating some more time towards learning any new course could be a little difficult or impossible. But after completing your MD Psychiatry, in fact, I would recommend that you do some course or certification in counseling or psychotherapy, because that, as I already said, helps a lot to deal patients with an integrated and holistic approach. Yes, there are many diplomas and certificate courses out there. Remember one thing, if you want to work in an organization as a corporate trainer or in an NGO or as a school counselor or get attachment of some kind, then remember those are the organizations which would always first prefer somebody who has completed MA in psychology, either clinical or counseling, further going on who is an RCI registered psychologist. So preference would be always for them who have done their full-fledged training into psychology. Okay. But from practice point of view, you can definitely go ahead and do diplomas or certifications. When you are choosing any of these courses, just connect with that institute from where you want to do and check whether you're going to get practical exposure or not. As in, is it going to be just the theoretical lectures into some therapy or counseling, or there would be a scenario where like internships, you know, where you see patients, you manage patients, whether you're going to get some supervision where you manage a few cases and you will get supervised and you will get feedbacks on your therapy or counseling. That is more important. Otherwise, there are many courses, you know, which are just online, which will just give you theoretical exposure. I don't recommend that because ultimately you have to apply that. It is a very applicative subject. So you can do diplomas and certificate courses, but just check whether they give you enough of practical exposure while you do that.
So audience, there's your checklist for courses along with MD Home Psychiatry. So there is one more question from AIA PGET Homeopathy. I would request, you know, I think probably if you could take this question jointly. Doing MD Psychiatry from MLDMHI for a student outside of Maharashtra, will the OPD and case taking be a drawback because of language barrier? I'll just begin with, because then, you know, in MLDMHI we do get a lot of queries from, and there are students in the past, even today, who are doing their MD in homeopathy in all the subjects who have come from outside Maharashtra, including from, you know, very different states, from the east, from the south, from the north, everywhere. And they have done quite well, they are doing quite well today. Language barrier can be there because obviously you will get a lot of Marathi speaking people over here when treating them. There is always an option where you will over a period of time learn that language, learn the language of communication. There will be a challenge. I am not saying it's going to be a cakewalk, but yes, it is possible.
Yeah.
So over to you, Dr. Ananya.
Yeah. Even when I was teaching at Dhawale Memorial Medical College, we had students who were, of course, I was in Department of Organ Ondo, but we had students who were coming from outside Maharashtra. Yes, they will struggle with the language barrier when it comes to case taking, but eventually they will learn. I think we all pick up whatever we are not good at. We eventually pick up. Obviously, they will have a little bit of struggle initially, but I think that is where I said in MLDMHI, at least we have that learner care thing. Right, where mentors are there to help you guide that in spite of this barrier, how you can work through or navigate through this difficulty. Right, so if you have right kind of mentors around you, if you have right kind of supervisors around you, this barrier would not be much of a problem if you want to pursue your education still.
I agree to that. I really agree to that. Because, you know, even I remember that initially, I mean, although I am from Maharashtra, my Marathi was not that good when I joined MLDMHI, but by the end of 3 years, I become quite proficient in understanding and speaking Marathi.
Correct.
It helped me later on my practice over here.
Absolutely. And just to add to this, one thing comes to my mind, even I think all of us struggled when we used to have the Bhopoli or the Pada visits, right? कि जहाँ पे वो ट्राइबल लैंग्वेज हमको कहीं कभी भी नहीं समझता था इन द इनिशियल टाइम्स, बट इवेंचुअली वी लर्न एंड मेनी टाइम्स, यू नो, द ब्यूटी ऑफ द फील्ड ऑफ साइकेट्री इज दैट lot of communication goes even non-verbal.
Yes.
So if you are good at picking the non-verbal communication, you don't want the, even if you don't understand that the patient is saying that I am going through something, you will realize that the patient is going through something. That is the beauty of psychiatry or psychology. So if you are good at your non-verbal communication, if you are good at sensing things, not just hearing or listening things, I think that will ease out most of the time this problem.
Agree. No, that was an aspect even which I would not actually think of, that body language and non-verbal communication. It is extremely essential in the field of psychology.
Absolutely.
All right. I hope we have taken up the questions, most of them, and I hope they have been answered to the best of your satisfaction. More questions you can write to us on MLDMHI and to Dr. Ananya Chitale for the subject that we took up today. Thank you so much, all of you. Thank you, Dr. Ananya, for taking the time out for on a Sunday and addressing this much needed topic at a time when students are taking admissions into their MD homeopathy. Thanks a lot on behalf of the institute and from myself. Yeah.
Thank you so much for having me. It is always great to come back home. I really feel that MLDMHI is always going to be my first or maybe second home at least, right? So it is always like coming back home. So thank you so much for having me here.
Thank you. Thank you so much, and thank you the audience for the patient listening. Hope to see you again.